Health New Zealand will stop using an equity adjuster tool that prioritised ethnicity as one of 5 factors in non-urgent surgical wait lists after a review found it was legally and ethically justifiable, but didn't follow best practice. It was justified by the then Labour government, whose Health Minister Aisha Verrall said she was happy with the policy that gave Māori and Pacifica patients priority over Pākehā and other ethnicities. Then Prime Minister Chris Hipkins said there was clear evidence Māori and Pacifica, rural people and those living in low-income communities have had to wait longer for care. But those that cried foul of such a policy included many surgeons that were not happy, arguing that they did not give priority to one ethnicity ahead of the others, and that it was those in need that should be at the forefront. National and ACT both strongly opposed it, as well, saying they would remove it if they were to get into government. ACT leader David Seymour called out the Labour government for treating New Zealanders differently depending on who their ancestors are. So, ACT campaigned hard against the use of this tool last year, and now it has come to fruition. Joining me now is ACT Health spokesperson Todd Stephenson. Todd, a very good afternoon to you.
Oh, good afternoon, Leah.
Oh, Friday, buddy. You feeling good? Feeling good, huh?
Feeling very good. I've just arrived back in beautiful Queenstown. It's a lovely sunny late afternoon here, and the snow is looking beautiful.
Oh, stop it. Love it. Todd, this is one of the policies that the ACT Party, along with National, was strongly opposed to. The party must be happy with this decision.
We're very pleased to see this health equity adjuster gone. Our policy has always been need, not race. And I think this is a great move by Health New Zealand to just go back to the four indicators, which are clinical need, where you are on the waiting list, how long you've been waiting, geographic location, and of course economic deprivation. And those things really do determine who should get an operation.
Ultimately, the review was unable to say how effective this tool was and whether it caused any potential harms. Todd, will we ever know how many Kiwis were or if they were harmed by languishing on waiting lists while priority was given to others?
I'm not sure we ever will, Leah, but what I can say is I know it would not be effective because a blunt tool like race in health actually doesn't indicate your likely health outcome. The things that do are the things that are still in place, right? Like, your ability to access services, income, living conditions, health literacy and education. They're the things that make the biggest difference to your, health outcomes. And so getting rid of this, doesn't, as it said, it was inconclusive because it actually doesn't get to the core problem of, why people have different health outcomes.
A spokesperson for Health New Zealand says they will continue to look into the possibility of adopting a new prioritisation tool or process across the whole of the system, but no decisions have been made. Are you aware of that? And what do you make of potentially a new tool?
Look, I'm not aware of that, but I know Minister Reti, I'm sure, will be keeping a very close eye on that. Look, again, it depends on what they mean by a new tool. If it's back to basics, like, clinical need and things that actually determine health outcomes and who should be prioritised, then, we'd look at that favourably. But if it's back to something, around race and treating Kiwis differently depending on their ancestors, we wouldn't be into that.
I see the Southern region and Northland have already stopped using the tool, but Auckland will now do so and revert back to pre-existing waitlist management systems. But Todd, we still do have a major problem, don't we, with our wait lists?
Oh, absolutely. I mean, look, our health system is, in a mess. You've obviously seen a lot of action by Minister Reti in the last, week or so, restructuring the leadership of Health New Zealand. And actually trying to get that organisation under control. Look, there's lots of really hard-working healthcare professionals out there on the front line doing their best, but it was a botched integration by the former Labour government, and they didn't do it. They didn't spend enough time getting that right. They tried to do it during a pandemic, and look, our health system and Kiwis waiting are suffering. I know Minister Reti and the other associate health ministers are doing absolutely everything they can to try and get the system back on track.
Toddy, if you'll allow me to, I just want to touch on a few other things. Are you wearing your ACT Party lapel pin at the moment?
I'm not right at the moment. I'm in a casual clothing today. You know,
Nice.
It's Friday.
Casual
I've
Friday.
been travelling, so I am not wearing it. Look,
There's been a bit of a brouhaha this week in the House, isn't it, about party pins and the Speaker. Can you tell us what that's all about?
Look, I think it's really, highlighting a bit of a bigger issue, Leah, which we're really concerned about the culture of Parliament and the standards. And look, the pin was really just a kind of symptom of that, and the Speaker, again, I mean, we're happy not to wear our pins if it means the culture of Parliament and the overall standard is going to improve. And look, I got to say, Kiwis aren't really interested in us, talking
Wearing
that much about
your pins.
our pin and what's happening in Parliament. But it is very important that Parliament is actually a safe and respectful workplace, and that people can actually go about their business, and that's what we're most concerned about ensuring.